everyone, it's Dr. Bird with Chiro Movement Muscle and Joint Clinic. In this video, we want to go over one of the tests for the hip called the Craig test. We've shown this before, but this test is very important. It shows us a lot of information about a person's hip, primarily the architecture of the hip. If a person is anteverted or retroverted, those two words are very important on our side, and they mean something for us. The word anteversion means that the hip is actually going to have more access to internal rotation, meaning the architecture of the bone, the glenohumeral joint on the pelvis or at the acetabulum itself has more access for internal rotation. The Craig test is done in this way, and we'll show this with Nicole laying face down. We're going to move the camera so we can see the hip more freely. Okay. To be very clear, on her leg she has a bend towards the pelvis. That pelvis, or that bend, is called the neck of the femur. That goes up and has a ball, that is the ball and socket joint for the hip. Okay. The acetabulum is an area or a space on the pelvis that houses that head of the femur, that round ball-like structure. For this test, the Craig test, how we do this, we have Nicole laying face down. That is called a prone position. On the side of her leg, she has what is called the greater trochanter. Now we're going to feel that greater trochanter and move her hip into internal rotation and external rotation. What I'm feeling for is when that greater trochanter is at its most outside position, meaning it's more out here. When we do that, we're looking at what position the hip is already in, meaning when I'm doing this, I'm not just rotating at the knee, I'm rotating the whole femur at the same time. And we see that she is actually more internally rotated at the femur when that greater trochanter is most lateral this way. That means for us that she has an anteverted position. When we do a history with a patient, if they are into squatting or deadlifting, it really plays a role into how you're going to have a setup, or how you're going to set up that. Are you going to be a toes straight forward, hips relatively straight forward, or more out into what's called a sumo position? So it's not... The reason this is important is you need to know what your hips are allowing you to do. If you have access to both, I think it's totally fair to say you should probably train both. However, we have tried this with Nicole. This doesn't work well when she tries to do a sumo position, a more out spread feet position. If we are doing the same test and the most lateral aspect of that greater trochanter was here, and her leg is here, that would be called a retroverted hip, or retroversion. That means that the architecture on the pelvis is set up that she has more access to external rotation of the hip than internal. Now, we have plenty of people that don't have a problem with either, and they have a good access of both external as well as internal, and that's totally fine. That tells us nothing of what she can do with her torso and how it's affected there. Doesn't tell us anything about the knee. Is very telling of just the hip and the positions that she can get into here. Again, that's the Craig test. I hope you enjoy it, and we use this again in clinic here as part of assessment for our patients. Thanks for watching, and I hope you have a wonderful day.